Hello and welcome to Beyond the Diagnosis, a show where we break down the barriers of medical science and simplify the complex jargon for your understanding. I am Dr. Viroshini Harikrishnan, a healthcare strategist, and with me, my co-host Dr. Ashish Philip, an orthopedic surgeon. Today, we will be discussing about sleep, why we need it, how much does it affect us, and so much more. So Dr. Ashish, could you please welcome our guest?
Well, Dr. Viroshni, we have with us a very special guest, Dr. Manoj Suryanarayanan. Manoj had done his MD from Moscow Medical Academy and then his residency in internal medicine at the Brooklyn Hospital Center. He further went on to do his fellowship in sleep medicine at Detroit Medical Center, USA. He is currently working as a sleep medicine physician with a prestigious hospital out of Pennsylvania, USA. Dr. Manoj has over 10 years of experience in this field and has special interest in the treatment of obstructive sleep apnea and circadian rhythms. Thank you, Dr. Manoj, for joining us on Beyond the Diagnosis.
Hey guys, it's really great to be here. I thank you for inviting me to speak here and share my educational background and training to give some awareness to the people so they can take better control of what's going on with their sleep, which eventually will translate into a better quality of life and health for them.
Hi, Manoj. It's amazing to come together for this. I mean, if I think about it, it was over 20 years ago. Was it over 20 years ago that we first met? It's so surreal for all three of us to be here together discussing things that are very easily ignored. Something so simple, something so trivial like sleep. We take it for granted. It just fills my heart with so much pride to see that you're working on something so simple yet so profound, so overlooked, and yet it impacts our quality of life. Manoj, maybe before we start, could you tell us a little bit about what is sleep? I mean, like, why are we struggling to understand what is sleep before we go into the whole technicalities of it? Maybe tell us what is sleep.
So sleep, if you really get technical, it's a period of relative quiescence. We are quietly resting usually in a recumbent state. That's for the human beings, for the Homo sapiens, if you will. We rest, we recharge our body. A lot of people think that there's really nothing happening, but sleep can be an active process where there's a lot of physiologic changes happening. There's a lot of memory consolidation that's taking place in sleep. For children, there's a great deal of growth and, once again, consolidation of what they learned during their wakefulness that takes place during sleep. So it's a very essential process. If you think about it, we all spend anywhere from 25% to a third of our life sleeping, depending upon how much sleep we all get, right?
I don't know, as a doctor, I think I've slept only quarter of my life. I don't think I've slept a third of my life.
I think if all three of us put our sleeping hours together, we would then hit what the average hits, 25%.
Probably. Probably.
That could be. That's usually the case in younger adolescents because we are faced with a lot of commitments. We go through a lot of assignments, homework. That's very applicable with high school kids, young adults and adolescents who work long hours, who have commitments to their family. So at the end of the day, if they can compromise on one thing, it ends up being sleep, which actually should be the other way. They should be focusing on getting adequate sleep so that they improve on their efficiency and performance during the day. And they could probably get more done for the same amount of time. You get more bang for the buck when you're well rested.
Yeah, I think that's a great point you made, Manoj. But contrary to what you're saying, I think the problem lies with most of us where we actually believe that when we sleep, we're not doing much. We feel like it's absolutely a waste of time, right? Sleeping. So I think that's the basic problem. So if you could actually just break down to us, I mean, you did explain earlier on that there's a lot of things which are really happening, which is you've got, like, in children, a lot of growth happens during their sleep. For us as orthopedicians, we know that a lot of muscle healing happens during the sleep stage. So if you can throw a little bit more light on it, that'd be great for people to understand that the sleep phase is not really something where you are just doing nothing.
Yeah, so to delve into that, I would really like to understand or explain the different stages of sleep because that's what is closely tied or intertwined with what's going on. Broadly, you could break sleep into two parts: non-REM or REM and REM sleep, REM. In lay terms, non-REM sleep, it's a phase of where your mind is relatively quieter, but the body and the muscles are not entirely quiet. So you may be able to make movements, changes in body positions and such in non-REM sleep. And REM sleep stands for rapid eye movement or dream sleep. So in lay terms, that's when we are dreaming. It's during non-REM sleep that we have, especially in the first part of the night, when we have what we call the slow wave sleep, is when you have a lot of growth hormone secretion, and children need that. And even as adults, disturbances in that kind of sleep can lead to conditions like diabetes, because growth hormone is closely tied to insulin production and insulin like growth factors, and not going through those cycles adequately can lead to metabolic problems. I mean, there's tons of studies which associate lack of adequate sleep to a pro-inflammatory state. So your body is as if in a state of inflammation when you haven't obtained adequate sleep, right? So you're more prone to getting infections. I have personally experienced that. I'm sure we all have gone through those phases where when you have not been well rested for a stretch of time, it could be for a couple of weeks, it's a lot easier to catch a cold. Whereas whenever you're rested, you feel like you're energized, adequate, and your immunity is way better. So there's tons of studies out there which correlate lack of adequate sleep to a pro-inflammatory there's a heightened circulation of inflammatory markers in the body. Those are some basic concepts that are happening in non-REM sleep. In REM sleep or dream sleep, there's all these neuronal synapses or connections. Think of these as micro batteries, which are constantly interacting and exchanging vital information among themselves. And whatever we learn, especially, during our active years, especially during childhood, all that learning and resynthesizing and processing and absorbing that information, all that consolidation takes place in REM sleep. That's a state where your mind is really active, but your body is technically paralyzed, because that's the way physiologically we are wired. Your muscles go into a state of paralysis. Otherwise, you would technically be in a situation where you could be acting out a dream. For instance, if you're running in dream, you don't really want to be getting up from sleep and start running. So it's amazing how the brain has programmed us to lay in a state of paralysis, muscular paralysis, but your mind is really active and processing all this information.
But how many stages are actually there? I mean, you've got the non-REM, REM, and then it goes in a cycle, right?
Yeah, absolutely. Great question, Ashish. Sleep medicine is probably the one of the youngest specialties in medicine itself, because even before the time that I started training, the non-REM sleep used to be classified into 4 substages, stage 1, stage 2, stage 3, and stage 4. But by the time I got into training, they kind of clumped both stages 3 and 4 as one stage, stage 3. Stage 1, I mean, for the sake of simplicity, stage 1 is a very light stage of sleep, which is usually the transition. It's the bridge between being awake and getting into the deeper stages of sleep. Typically, we spend literally a couple of minutes, and then we could easily transition into the deeper stages of sleep. Then you have stage 2, which is somewhat deeper. And stage 3 is called the slow wave or delta sleep, which is when the great deal of all these, hormonal, physiologic, growth hormone, all these processes physiologically take place. So those are the substages of NR non-REM, and then you have REM. That's the dream sleep. So those are the stages. Each sleep cycle lasts anywhere from 90 to 120 minutes. So think of us cycling through these different stages of NREM and REM sleep every 90 to 120 minutes. Believe it or not, we all go through ideally REM cycles three to 4 times in a night. So we could be dreaming as many number of times, but we tend to remember the dream that happened towards the time that we woke up or we are waking up.
So we can wake up any time between these cycles. It's normal to wake up, or do you notice that you wake up only during after an REM or an REM? When do people normally wake up?
Great question. We could pretty much wake up anytime. These are called EEG arousals or arousals from sleep. Technically, these are supposed to be brief arousals if they are physiologic, or they could be much longer in the context of an underlying sleep disorder. You could wake up, common symptoms. Maybe I wake up for no reason. I wake up much more frequently than I think I should be waking up, or I wake up and then I find it hard to go back to sleep. I'm wide awake for 20, 30 minutes and then I've only been sleeping for 2-3 hours and I think I should be sleeping more, but I wake up and then I struggle to go back to sleep. So waking up could be brief. If it's really for a few seconds, you're kind of rolling over, changing your position, going, sleeping from your back to the side or from your back to the stomach. Those are pretty normal as long as you're able to get back and maintain sleep.
Got it. Manoj, that's very interesting. And this is going to be a good segue to the $1,000,000 question I think we all had at the beginning of this podcast. What is optimal sleep? Is there a perfect definition of that? With Ashish and I averaging about 4 to 5 hours of sleep a night, does that make it pathological? Should we be sleeping 7 to 9 hours? What are we missing?
So there have been tons of studies conducted, right? Looking at hundreds of thousands of people. And there's a great study called the Sleep Heart Health Study. That goes back into the 90s, I would think. I think this was based out of Wisconsin. But basically, the crux of it is that the magic number is anywhere between 7 and 8.5. Where each person falls is for us to figure out. If you wake up after 7 hours of rest, you still feel like you are having to push to get your day going, then you're probably not a 7 hour person. You may be more like an 8 hour person. But if you're able to get 7 hours of sleep, wake up and feel absolutely ready to go, that's a 7 hour person there. But I would say that 95% of the world's population fall in the 7 to 8.5 hour frame for their optimal sleep. Studies also suggest that generally when people sleep for an extended length of time, less than 7 hours, or probably possibly more than 8.5 hours, again, you have to take it with a grain of salt because each person is somewhat genetically different from each other. And so that leads to an increased propensity for heart and metabolic problems. So less than 7 and more than 8.5 can be associated with health risks.
Manoj, this is interesting. You said 95% of the population of the world should get, or do they get, 7 to 8.5 hour study? Because I thought the numbers would be significantly lower given our quality of life currently. Look at how much technology we have hooked up to us. We've got blue light. We've got work hours that are gruesome. We've got a pandemic going on. Therefore, work-life integration is now, I would say, very unhealthy in the sense that there's no boundaries at home. So did I hear you correctly when you said 95% of the population in the world gets 7 to 8.5 hours of sleep?
Yes, Roshni, I believe I'm right. It's 95%. There is an exception. There's people who are genetically short sleepers, where as little as 4 hours are good enough for them. And then there are long sleepers too, people who need 9 hours and more, sometimes even as much as 10 hours. They are called the hypersomniacs, or excessively sleepy people. But again, it's not very commonly come across. Usually that's where being evaluated in a sleep disorder center can make a difference for such people. But the odds are that you're somewhere in the 95% group.
I think so. I maybe sleep about 5 hours a day, and I think that's enough. But I do understand what you're saying, because my trainer keeps asking me to hit 7 hours minimum. He says it's very important for me to balance out my human growth hormones, and especially after we do a gruesome circuit in the gym, he expects me to get 7 hours of sleep, nothing less. And that's something he's a stickler about. But I'd like to come back to another point. Do you think you could share with us some of the observations you've had with the pandemic? What have you noticed? What studies have you been able to get your hands on, or what have you been studying that you think would be a adverse impact on quality of life and sleep going forward in a post-pandemic world?
Yeah, so the first thing that comes to my mind is increased screen time during the pandemic. Obviously, we are bound to our homes. We haven't ventured out a whole lot. Children spending too much time in front of screens, even adults spending a lot of time in front of screens. There should be a ceiling. There should be a time frame. Ideally, it shouldn't be during your sleep hours. You really want to keep sleep hours for sleep and not for anything else. It's funny when people say I get 7 hours of sleep, and then when you really discuss with them what their habits are, they say, oh, I get in bed. I either watch my favorite show for 30 minutes and then I fall asleep, or I'm on the phone. I'm listening to some podcasts, or I'm listening to some music or YouTube videos more often than not. And they lose 45 minutes of their time, but yet they include that in their sleep hours. So they're giving themselves about 6 hours of sleep opportunity, but people generally tend to overestimate the amount of sleep that they're getting if you pay attention.
So, Dr. Manoj, I just want to take you back to what you had said earlier on, which is that the average sleep which a person should be getting is roughly around 7 to 8, 95% of the people. But one thing which I've noticed per se within myself, is that when I was younger, probably I didn't need much sleep. I could work with 5 hours or 4 hours or even 3 hours was fine. But as I become older, I feel like I need 7 hours. If not, my next day is really bad. I can't get go. So that's my question. Is it relative to our age? Does how much sleep we get, like as a youngster and as an elderly?
So great question, Ashish. I think sleep generally evolves over a person's lifespan. If you think about it, newborn babies, neonates sleep as much as 20 hours, and they need that. And as we transition into the first few years of our lives, we tend to range anywhere from 12 to 14 hours. Children may be allowed naps at their daycares and learning centers, which is important for them. Children can get into coping problems because they don't have a way to express sleep deprivation. A lot of children become more hyperactive and get more cranky. That could be a way of expression from these children about the fact that they are tired and they want to sleep. And then as we progress, we get down to more like the 10-hour sleep zone for the 5 to 6 year range, more like 9 hours as we get into being about 10 years of age. And once we get into puberty, adolescence, and young adulthood, that's when we start transitioning into more the 7 to 8.5 hours of sleep. Interestingly, as we age, as we get older, people tend to lose the ability to get into deeper stages of sleep. This is because, again, our brain is wired in such a way that we are more sensitive to subtle changes that are happening around us. Little things here and there tend to be a lot more disturbing. And in general, by the time we are 60, 70 years of age, a lot of people have trouble getting past 6.5 hours of sleep, which is fairly okay. As long as when you wake up, you feel reasonably refreshed and you're ready to go. That's fairly understandable that as we age. Now, getting back to how you were able to get by with 3 hours of sleep. Again, as the younger we are, the more coping mechanisms our body is equipped with. And as we age, again, we tend to be more cognizant of the gaps that we have in our health. So getting those 7 hours of sleep in the middle ages, 7 to 8 hours is extremely important to cope.
Wow, that was really informative, Manoj. Thank you so much for at least breaking down and making us understand the initial part of a sleep cycle is and where the problems can lie and what type of different disorders we might go through. I think we really need to discuss further about what are the different problems which we face during these cycles and how we can go about treating these problems also probably. So for this, let's take a small break and then see you on the other side.
Every day, whether you're running, taking a walk, traveling, stuck in traffic, or just doing nothing, tune into the Old Couple podcast for great company every fortnight on your favorite podcast network. A Pandemia Inc. production.
Welcome back to Beyond the Diagnosis, not your typical medical podcast. Manoj, if I can just ask you, so besides being hyperactive, what are the different signs or what are the ranges that we're looking at when people are severely sleep deprived or chronically sleep deprived? And how do you define chronic sleep deprivation? Like, how do I know I'm being sleep deprived and I'm not just a genetically light sleeper?
So, common symptoms could be, the first thing is you wake up, you need to push yourself. You really have a great deal of sleep inertia. You're barely able to get out of bed. That's the most common sign that you didn't sleep enough, or you slept enough, but it wasn't great quality sleep, which is what some of the sleep disorders are about. You could wake up with headaches. You could wake up with and struggle with fatigue. But here's the more common symptom. A lot of times people can get their day going, get their day started, but it's usually in the afternoon hours during a meeting or when they're sitting and doing their work after lunch is when they experience a great deal of sleepiness and struggle to get over a couple to 3 hours of their afternoon into the evening hours. Sometimes people can say, I come home, I'm watching TV and I can barely stay awake. I doze off, or those could be symptoms. In general, people can talk about brain fog and attention focusing abnormalities or difficulties.
That's very interesting, Manoj, because, I wanted to ask you that. Is it necessary for us to get 7 hours of sleep together? Or is it okay if I get 4 hours of sleep at night, 3 hours in the afternoon? And I think earlier on, there used to be a period when people used to sleep by when the sun goes down at 6. They sleep till 12. They wake up from 12 to 3. They would do some personal work and then go back to sleep again, So there used to be a cycle like that also. So what's your take on that?
Interestingly, in countries like Italy, they still allow for siesta time. The magic zone is somewhere 2 to 4 p.m. time frame. But again, that ties to the sleep process. So if you let me take a moment to explain the sleep process, it'll help us understand a little more about how you could sleep. Again, you need to keep in mind that we go through sleep in different stages of sleep in cycles. So when you break the sleep portions into parts of 4 hours and 3 hours, or 5 hours and 2 hours, you need to keep in mind that the ability of your body, you're not giving the adequate opportunity for your body to go through the sleep cycles, which it would if you were to continue sleeping, right? And that continuity of sleep is way better than breaking it deliberately and taking different chunks of sleep, which a lot of people do, especially when they're doing shift work. Night shift people, they come home, they sleep first for a few hours, and then they wake up, they're awake for a length of time, and then they catch a shorter nap before they go to work. If you ask them, maybe a lot of them are able to cope with it, but a vast majority of them do struggle with energy levels, and it tends to build up.
Yeah, I've never enjoyed those shifts.
Ashish, also, I think based on what Manoj just told us, you and I should be moving to Italy soon.
Yeah, I think so, Roshan.
Manoj, on that note, can I ask you, do we really recover from all these disruptions when we were interns, when we had to do the graveyard shift, we worked for 36 hours nonstop, things like that? Do we ever recover from all of these disruptions, or does our body cope? What really happens?
Yeah, we tend to cope. Again, the coping mechanisms differ by person, differ by age, but most of the time, sleep extension is what we call. That's the glorified term for sleeping more or sleeping in, to cope for lost sleep, which is perfectly reasonable as long as it doesn't mess up your ability to fall asleep on subsequent days. And again, let's get back to the sleep process itself, which will help us understand. So sleep is driven by two important processes. One is sleep pressure. In simple terms, the longer a person is awake, the greater the pressure to fall asleep. The other component that determines sleep is what we call timekeepers. The most important timekeeper is light. We all, Ashish mentioned, we are designed, before the invention of light, we were designed to go to sleep at dusk, wake up at dawn, and then be awake during the day, hunting, raising families and taking care of cattle, whatever be the case. So really, light is a timekeeper, and the other one is melatonin. So melatonin is a chemical which prepares your body to go to sleep. Usually, most people, the release of melatonin begins sometime after dusk. So usually in the modern world, I would say between 7 and 8 is when your brain starts making melatonin, giving signal to your body that it's time to start preparing to go to sleep. So light, melatonin, and sleep pressure. These are the three determinants of sleep. So regardless of, your body could be making adequate melatonin, but if you take a nap at 5 p.m. for 2 hours, there's no way you're going to be able to go back to bed at 10 and fall asleep, right? I mean, it's going to be different.
On that note, can I ask you a very quick question? Because this seems to be quite a popular one. Does melatonin supplementation work?
It does and it doesn't. Clear as mud, right? Yeah. So melatonin can be useful among people who may be feeling wired after they come home after a long night's work, and then they're trying to go to sleep, but then they have exposed themselves to a lot of bright daylight, and now that light is telling a different information to their body, saying it's time to be awake, when they have already been awake for 12 hours or longer doing their night shift. So during those circumstances, melatonin can help. Certain people with circadian rhythms, meaning their internal biological clock lags behind a conventional sleep schedule. So the rest of the world is going to bed at 10, but a person with a delayed circadian phase or a delayed internal clock is going to bed at 2 a.m. or 3 a.m. And they have done that for all their life. So melatonin can play a role in helping them gradually advance their sleep to a more conventional schedule. But in general, melatonin has been used to augment the quality of sleep among people with some degree of people who complain of my sleep is not that great quality. I feel okay. I feel like 70% okay, but I have like brief arousals, brief awakenings throughout the night, which I think are not really right, shouldn't be happening. So melatonin can overall help augment the quality of sleep. Again, it could be a hit or miss thing. Some people respond better than others. The other challenge with melatonin is that it is not a well-regulated supplement available in the market. There are a lot of additives. So what concentration of melatonin is available in a formulation that you're taking may have a role to play in whether it's having an effect in improving the quality of your sleep or not.
Yeah. Manoj, do you think this is a good time for us to talk about disorders?
Absolutely.
Yeah. Okay, let's get into it.
Yep, absolutely. I'd love to delve into it right away. So sleep disorders, again, for simple terms, you could categorize them into broadly. First one is insomnias. People who have difficulty getting to fall asleep or staying asleep or both. Sleep-related breathing disorders, where people have snoring is a sleep-related breathing disorder. But more commonly, obstructive sleep apnea is the condition that's the most common sleep disorder that is currently being treated, I would say, in Europe. United States. So sleep-related breathing disorders is the second category. Sleep-related movement disorders, where people may have, before they go to sleep, you could have people who experience a sensation of intense restlessness in their legs. They have this urge to move their legs, or they have, some people describe it as bugs crawling up their feet, and they need to literally brush it off while there's really nothing. Or in worst case scenario, they may be compelled to get up and start walking around in their room for 15-20 minutes before they're able to get over that urge or that sense of discomfort, and they're able to fall asleep. It tends to eat into their sleep onset, their ability to get into sleep. So already they've lost 20-30 minutes of their sleep time because of that urge. So that was the third category. So sleep-related movement disorders. Parasomnias, which mean basically sleep-related abnormal behavior or atypical behavior that is happening during sleep or related to the sleep period. And finally, circadian rhythm disorders. Circadian rhythm disorders are related to your internal clock, the biological clock. Most people say, hey, my biological clock is so well regulated. At 5 o'clock, I automatically wake up without even setting an alarm. I've done this for 20 years. I've done this all my life. You have a handful of patients who say that their biological clock or their circadian rhythms are well regulated. Whereas there are others who may be night owls. And then there are yet others who need to be asleep by dusk, and they're up at, like, they are the morning larks.
I think, Manoj, you talked about a few of these sleep disorders, and I'm sure that the information is overwhelming for each one of them, and we can really actually take them and break them down into individual topics and talk about it. So I don't want to go into it really very deep, but there's a few questions which I wanted to ask you, mainly related to two of them, which was, one is sleepwalking and the other is sleep apnea. So with sleepwalking, I think most of us are quite aware of it. We've watched enough movies, we've kind of heard about this in books, we read about it. So, but one of the questions which is always asked, and which is, the biggest question over there, is when somebody is sleepwalking, do we wake them or do we not wake them?
Yeah, very relevant question. So sleepwalking is a kind of parasomnia. It happens during non-REM sleep. It's not a time when we are dreaming or REM sleep. Remember, I said when we are dreaming, our body is in a state of paralysis. So we are not normally wired in such a way that we'll move or act out our dream. So a person who's sleepwalking is really not dreaming. Technically, it's happening during slow wave sleep. It is usually a disorder of childhood getting into adolescence. And a lot of people, the vast majority of those people, outgrow sleepwalking. If it continues into their adulthood, that could be a pathology. Really, there's not a targeted treatment for this condition, except you want to make sure, there are certain kinds of seizures which happen during sleep, seizure epilepsy during sleep. And sleepwalking can be a symptom of epilepsy in sleep, purely isolated to sleep. So an evaluation from a neurologist may be warranted if someone is doing it pretty much on a consistent basis. We call it stereotypy, or frequently you see the same pattern of repetitive behavior. So that could be a sign of seizures. But short of that, it's a fairly benign condition where someone may be getting up and walking in sleep. The only little things that you can do for those people is to prevent self-injury. So you want to make sure their room is clear of objects, their pathway, their walkway to the bathroom or whatever, to the doors are clear. So literally it's about behavior changes and changing their sleep environment, making it safe for themselves and for the rest. But really, there's no need to wake them up. If you wake them up, they have no recollection of it. Most of the time, things happening during slow wave sleep, people have no recollection of.
What happens if I wake them?
They may act confused, or they may really not be aware of how they got there. Most of the time, that's about it. Sometimes little children may break into tears, they may cry, they may have a little difficulty getting back to sleep.
But no permanent damage, right? It's not like they're gonna.
It's not going to cause any neurologic damage or anything. I don't think there's any information supporting that. You want to do it safely so that you're not startling them and you're kind of easing them back into sleep. That's all that you have to do. Yeah.
Manoj, on that note, could I just check with you? Is there a mental health element to the onset of these two situations, to any sort of parasomnia? Is there a trauma that precedes it? Is there something that we're not catching on? What do you think?
Absolutely. Yeah. Great question, Roshni. I think so. During childhood, there could be traumatic incidents. By the way, that connects me to bedwetting. So usually little children, say 4 years old, 5-year-old children who are already trained, bladder trained, may have regression when they have a younger sibling. That's been associated with. So that's a condition, but then it tends to resolve. So a 4-year-old boy now has a baby sister or a baby brother, for some reason begins to lose control of their bladder. They just need reassurance. I don't think they need to be disciplined. I don't think parents need to be hard on them. Childhood trauma can lead to a different kind of parasomnia. It's called nightmares. Nightmares are happening during REM sleep, not during non-REM sleep. I have taken care of a lot of veterans who have been in Iraq, who have been in different kinds of combat situations. They wake up with pretty bad flashbacks. People who have gone through a traumatic adulthood, people who go through a lot of depression, abuse, emotional, physical, any kind of thing, they can have these kind of events. In general, sleep deprivation, those stages can be associated with some degree of parasomnia, sleepwalking, and such.
Superb, Manoj. Thank you so much for throwing some light on that. But what about the sleep apnea part? I mean, we've seen this in movies where they got like a CPAP machine on their face, and what's the deal with sleep apnea?
That's really funny. The latest update that I hear about CPAP being used in movies is the most recent Spider-Man movie. I was told that the bad guy there was wearing a CPAP on some sleep physician forums. I've heard how it's funny that the bad guy is actually using an older version of CPAP mask that's not even being made. It's been discontinued anymore, and Marvel couldn't afford one of the recent masks, which was a funny thing. But anyway, getting to obstructive sleep apnea, it's a kind of sleep disorder which comes under the broad category of sleep-related breathing disorder. Sleep apnea is a condition where there's an instability in breathing. So a person commonly says they're snoring, or people hear usually their bed partner hears them, they say, oh, this guy snores like a freight train. This guy snores as if he could take the roof off. Or sometimes, the bed partner can observe a person who has the condition to be choking or gasping for air. They may be making weird gurgling noises in sleep. Sometimes, when someone is observing, they could go for several seconds without taking a breath. It seems as if they're not breathing. And a lot of times bed partners need to shake or end up shaking them or nudging them to wake them up, and so that they start breathing. So these are the common symptoms of observed symptoms of obstructive sleep apnea, which can translate to a lot of daytime symptoms. If you think about it in simple terms, what's happening is when the person with obstructive sleep apnea is transitioning into sleep, their upper airway collapses and closes on itself for several seconds, which is tied to a somewhat natural underlying tendency. All of us have more collapsible airways. There's a lot of airway instability as we go from being awake to being asleep. But generally, in the people who have obstructive sleep apnea, they have certain risk factors. They are either overweight, they have a narrow upper airway, relatively large tongue, or they have a crowded, really lot of soft tissue inside their upper airway, which tends to fall back, which regresses into their upper airway and causes obstruction. So the person may be making an effort to breathe, but there's no flow of air because there's an obstruction to the flow of air. As a consequence, there's a disturbance in oxygenation, which usually lags behind by about 10 seconds after the obstruction takes place. And the brain perceives that there's a disturbance in the way this person is breathing. So in order to restore their normal breathing, it causes a gentle awakening or arousal from deep sleep to lighter stages of sleep. And when that happens, the airway opens up again. So the airway which is stuck together is now open again, and the person starts breathing again, only for as long as the obstruction takes place once again. And this process keeps happening repeatedly throughout the night, which is what determines the severity of the condition. But in simple terms, it's an airway obstruction which needs to be overcome. What CPAP does is it pushes air with pressure, and that pressured air works like a splint or an airway stent, overcoming that obstruction and restoring normal flow of air and normal breathing during sleep.
But Manoj, you were talking about partners observing the problem and seeing that, okay, the person's not breathing or shallow breathing. But what does the person perceive? Is his next day like, what does he feel? Is it the sleep is not great? Or is it just that he never gets into a deep sleep, so he never dreams? So what are the symptoms which are perceived by the patient?
The symptoms are pretty broad. They could go anywhere from the person just waking up feeling poorly rested. They feel like, oh, I spent 7 hours in bed. I feel like I got run over by a truck. I barely slept. They may wake up with headaches because there's a lot of muscle tension from constant snoring in the upper airway. They fight through tiredness during the day, focusing problems, difficulty with, concentrating and absorbing material. A lot of times drivers, it's usually when they're driving is when they feel they're hit with sleepiness. So most likely these are the same symptoms of extreme sleep disruption, or the person has absolutely no control. There's any moment they sit down, they can fall asleep.
Manoj, I just wanted to check with you. I mean, this may be a controversial question, but it's a question that I need to ask. Do surgeries to help correct floppy airways or collapsing airways, do they actually help with sleep apnea? Or are we over correcting? Are we being very quick as opposed to doing something more conservative with the treatment modalities like lose weight, exercises for the jaws? You know what I mean? Sleeping positions. Are we very quick to, cut and fix and stuff like that?
That's an awesome question. Surgeries for obstructive sleep apnea are becoming obsolete, especially in the adult population. More so, the pediatric population will immensely benefit from removal of tonsils and adenoids. That's the only surgery that has been shown to be of any benefit, and that's limited to the pediatric population with documented enlarged tonsils and adenoids. Short of that, surgery is not being offered as the first line of treatment
Fantastic.
for 99% of the adults with obstructive sleep apnea. Yeah, you're absolutely right. Weight loss, positional therapy, sleeping more on the sides, limiting alcohol intake close to bedtime because alcohol can have an effect on your airway being more floppy, collapsible, and positive airway pressure is, these are the most commonly prescribed methods of treatment. More recently, there's another method called hypoglossal nerve stimulation. Again, it is restricted to a very select group of patients, but you're absolutely right. More often than not, resort to conservative methods. Interestingly, studies show that the prevalence of obstructive sleep apnea ranges anywhere from 30% to 60 or even 65%, 70%. Some studies show high prevalence. If you think about it, simply stating, every other person probably has obstructive sleep apnea, right? And, population studies also seem to indicate that there is a greater prevalence of obesity in general. I view that correlation of increasing prevalence of obstructive sleep apnea with increase in the obesity prevalence. That's one of the risk factors for obstructive sleep apnea.
Thank you, Manoj. But before we end or before we wrap up today's very, very informative podcast, there were a couple of questions that came up from some of our listeners. The first one being, do wearables actually reflect my real quality of sleep, or is that just a rough guideline? The second one is, how far off sleep timing should I work out? What'll happen to me if I work out too close to, the time that I actually go to bed? Why am I having trouble actually falling asleep after I have a heavy workout session at night? So these are the two main questions that have come up. Can you sort of help our listeners answer these questions?
Sure. For the first question, technology, try wearable devices, your smart watches, iPhones, any kind of smartphone that has applications that can track your sleep. Take them with a grain of salt because it is hard to actually test them and validate them. I would say, barring a couple of these devices, which are actually used in the world of sleep medicine to diagnose people with sleep disorders. There's a brand called WatchPat, and then there's a couple of other brands that are out there which have been formally tested, compared with actual sleep studies in the lab to validate their reliability. Short of these few devices, which are really a handful, you can literally count them on with the fingers on one hand. The vast majority of technology devices, wearables out there have not been validated necessarily. So you'd want to take the information tracked by these devices with a grain of salt. You can use them as a rough guideline to track, as a reminder. If it says that you were in bed for only 5 hours, that's true. You were in bed for only 5 hours. That's a reminder that maybe the following morning you wake up and you don't feel that well rested. It's a reminder to yourself. So a lot of these technologies, I would look at them as a supplement to the gaps that we don't pay attention to. So I hope that answers your question, Roshni. I don't think I would, if a device says that you only had 10 minutes of REM sleep, I would take that necessarily as the gospel truth, because, if you also have the subjective perception. If you wake up feeling that you rested well, but the technology shows that you had crappy sleep, I would absolutely not take that, as a valid point. So you supplement anything with your subjective analysis and validate that to some extent. You use that as a guideline to track your sleep habits, try to make them more regular, and be aware of the gaps that you could improve on. Getting to the exercise part, exercise, as we all know, leads to release of adrenaline. Adrenaline is a counterproductive hormone to sleep. There are hormones which are considered to be wake promoting. So they promote a state of being more awake or alert. And adrenaline is a fight or flight hormone chemical that triggers the fight or flight response. So you really don't want to do an intense workout for an hour and then try to go to bed, because there's still a lot of circulating adrenaline in your body, which is not going to be able to let you relax, settle down. So it's going to be a lot more challenging for you to go to sleep. So timing of when you exercise, when you work out, the intensity of exercise, all that matters. If you're just walking around at a gentle pace after a heavy meal, an hour or two before you go to bed, probably wouldn't make a big difference. If you're going out for an intense cardio or weightlifting for 20-30 minutes, and then or running on a treadmill for 30 minutes, and then literally within the hour you're trying to go to bed, it's going to make it very challenging. So you want to give yourself at least 4 to 6 hours of break from an intense session of workout for the adrenaline to be washed out and for you to be able to go to sleep. By the way, timed exercise is one of the factors for improving sleep hygiene. So at any point in the day, if you're able to incorporate, provided you give adequate gap between your sleep time and the exercise, incorporating an exercise schedule in your daily routine is extremely conducive to sleep. It's one of those things that's recommended in the habits of improving sleep hygiene for insomniacs, for people who have trouble getting to fall asleep. Try to incorporate exercise, but make sure you have enough gap between the time you work out and the time you go to bed.
Manoj, I have two very pressing questions, which I think all of us want to understand. Do you have any advice for us to hack sleep? How do you get great sleep? Or would you just like to talk about sleep hygiene? Which way would you like to position it?
So generally, you want to keep your sleep hours as consistent as possible. Try to avoid variability. The more trouble you have getting to fall asleep and staying asleep, that person should try to be more consistent with their sleep hours. It wouldn't be that much relevant in someone who can fall asleep at the drop of a hat. You have those lucky folks who can fall asleep at the drop of a hat, so this probably wouldn't matter too much to them. But in general, the first and foremost is to keep your sleep hours fairly consistent. Don't give a lot of variability on the weekends or your days off, because one thing that people tend to do is they sleep in for 2-3 hours. I mean, there's a wide variability between weekdays and weekends of the wake time can have a gap of 3 to 5 hours, which is really bad. So you want to keep it as consistent as possible. Try to avoid taking naps during the day, especially if you're someone who's sensitive. And if you really do need to nap, keep it at a time so that you have at least 8 hours from the time of napping to the time that you go back to bed. Keep the nap short, preferably 20-30 minutes and less. By the time you're getting into the 20-30 minute zone, you're already getting into the part of slow wave sleep. Because if you go back, recap the sleep cycle process, every 90 minutes we cycle through different stages. And by the time you hit the 20-minute mark, the odds of getting into slow wave sleep or deep sleep is pretty high. And people can wake up from a nap feeling groggier than before then when they went to take that nap. So keep the nap really short and keep it at least 8 hours before your actual sleep time at night. Keep your sleep room really conducive to sleep. So really it should be dark. For night shift workers, ideally you want to use room darkening blinds if they're sleeping during the day.
Blackout
But
curtains.
in general, keeping the room nice and dark. If some people have difficulty getting to fall asleep, if it's too quiet, they can use white noise, a source of white noise. A fan, a standing fan or a ceiling fan is a good source of white noise. They can use something like that. Try to avoid too much caffeine before you go to bed. Ideally, you want to give at least 6 hours, because caffeine not only has a stimulating effect, as we know, it's a diuretic. It can make people pee a lot. So you may wake up too many times through the night to use the restroom. That can eat up your sleep time and be disruptive to sleep. Similarly, limit the intake of alcohol before you go to bed, and try to incorporate an exercise regimen. Try to take a warm bath. A warm shower is extremely conducive to sleep. And, in the rare event you need to take a supplement, melatonin is a good sleep supplement. Try to avoid any of the over-the-counter Benadryl and things like that, because that can leave residual carryover grogginess and such during the day. I would say those are generally good practices to follow.
Got it. Manoj, sounds like all the so-called punishments we had as children really would help us as adults to maintain really good sleep hygiene. Like, a warm shower before you go to bed, really dark room, no screen time, limited TV hours. I mean, these were our childhood punishments, weren't they? So yeah, I get it. I get it.
Absolutely. Yeah. I mean, if you think about it, probably there was a meaning. It's just that we were never explained the meaning or the reasoning behind the rationale behind all these. Yeah. Great point, Roshni.
All right. Thank you. And Ashish, I'll hand it back to you.
Wow, thank you so much, Manoj, for coming on this show and making things so relatable to what we've been going through in most of our lives. And we in the healthcare profession are quite well known to, to have these kind of problems and these kind of issues. So thank you so much for throwing some light, which might probably help us a lot as we go through. As usual, we had a great show. Thank you, Roshan, for co-hosting the show with me. Thanks again, Manoj, for coming on the show.
Thank you guys for having me. It's been a pleasure being here, and I appreciate the opportunity to share whatever I know to enlighten people and make them more aware. If it makes a little difference to their daily lives and improving their quality of sleep, I think I would take that as a success.
Sure. You can find Manoj's link in bio in our description. So if you want to throw over some questions to him, you could probably do that. Please continue to follow us, like us, and subscribe to the show. All our link and descriptions are down below. And until next time, take care. Goodbye.
Goodbye, everyone.